Hi everyone, I'm Gretchen Bailey with Optometry Times, and I am joined now by Ahmad Fahmy, who is the founder of Twin Cities Ocular Surface Disease Symposium. Ahmad, thank you so much for joining me today.
Of course. Thanks for making the time, and I'm happy to be with you.
I have to tell you, saying Twin Cities Ocular Surface Disease Symposium is quite a mouthful.
It is. I think most of us have just started to say the Twin Cities OSD meeting or
I like
Twin
it.
Cities OSD. Yeah.
I like it. I'll have to do that moving forward. Well, this year, this is your third annual meeting, and you are combining forces with Damon Dierker's Dry Eye Boot Camp. So
Yeah.
tell me how that all came about.
So basically, of course, if you, in the beginning of the global pandemic, really my meeting was one of the first in the country that needed to be postponed. I went through, as you can imagine, all kinds of different calculations and considerations. And, it was a week before our meeting that I really knew that the safe and careful thing to do is to not have an in-person meeting. And really, I was frankly kind of just resigned to make 2020 a year that we're going to pause and, think about how to come back in 2021. And it was, it was just a serendipitous event where, Damon and I were talking, and the idea came about that maybe we should be, really looking at these virtual platforms. And once I started to really research the virtual platforms and the things that are possible with a virtual meeting, I was really actually excited about it. But where I am now is even more excited about the whole virtual, concept, because there's so many things that we've discovered throughout the way that there's a lot of neat features it can do virtually. And, it just made sense for the dry eye boot camp and the Twin Cities ocular surface disease groups to really, if we put those two things together, we're really addressing the full continuum of ocular surface disease and dry eye disease. And so it really has, if we put those two tracks together, anybody that, sort of everyone that's involved in ocular surface disease or dry eye has something there that should be of really a great interest. And I think that putting those two meetings together was really a natural fit, where most folks, I really think that, most folks will really come out with some useful information that they'll be able to put in practice, depending on where they are as far as their comfort level and their clinical practice. So that's basically how the thing, how it all came together. And, I would just, like to thank, Dr. Dierker has been just phenomenal to work with. I couldn't have asked for someone who's just as, sort of as passionate about making sure that we're doing things in a very proper and methodical way. His work ethic is phenomenal. And I just couldn't have asked for a, better colleague to collaborate with on this. So when you have all these pieces together, the medical education company that's helping us, Alana and Jeremy, we just have some really neat people around this project. And so it all came together really nicely.
That's great. I'm glad that you're hitting different ends of the spectrum with dry eye, so you're hitting most practitioners wherever they happen to fall on the continuum. And it's great to see people combine forces and perhaps bring even more awareness to your meeting, to his meeting, and now jointly moving forward. Do you
Yeah.
anticipate next year that you'll join forces again? I'm assuming that we're going to have, let's just assume, in-person meetings. Do you
Yeah.
think you'll continue to join forces, or do you think that you'll have separate meetings moving forward?
I really don't know. I have to be honest with you. We have not done sort of the debriefing meetings. I think that there's definitely a ton of potential. But I really don't know, frankly, what 2021 will look like as far as meetings in general.
Right.
Uh,
There
um,
might not be any.
yeah. And so what I can tell you is that I think that, there's been a lot of very neat things that we've been able to do through the virtual platform. But Damon and I are gonna, and everyone involved are gonna kind of put our heads together and just kind of have a nice meeting where we set together some goals and see where things go. We kind of thought we wanted to get this one under our belt.
Right.
And the way I think about things is that if you're doing something valuable and we're really driving at the same goal, which is improving people's lives through all of this, and our colleagues feel like there's some value in it, then it makes sense for us to work to improve upon that and keep doing that.
Sure.
So those are all my thoughts on that. But I just think that there's a ton of potential for us to keep working and collaborating and improving the quality of education. And if we're in a situation where we are not able to meet together, I think that we have to think about doing things virtually.
Sure. Sure. Well, great. Well, thanks so much for taking the time to talk with me today.
Of course. Thanks so much, Gretchen. You take care.